But I want to welcome everybody to the March edition of the second Tuesday Hypnosis Group. Thank you all for coming to the Leaning Tower Y here. And we're zooming from all over the United States. There's, I know we've got Arizona here, at least. So we've got a good talk tonight. Kayla Bailey, she's going to talk about her experiences working with people with cancer for 24 years, both as a dietitian and as a mind-body therapist and a Reiki master. And she'll talk about hypnosis and a little bit about introducing hypnosis into a medical setting. She's been a speaker at the conference, at the Mid-America Conference in October, and I was blessed because she was in my room, so I could hear her speak on that. And that was good. So let's all welcome Kayla Bailey with "It Runs in My Family: How You Can Help People with Catastrophic Illness."
Okay.
Thank you very much for coming.
Thank you for having me. I really, really appreciate it. So my handout looks a little strange, and I apologize for that, but that's because I wanted to get a sense of how I can help you think like I think when I'm working with people. So I'm going to take just a little bit of time and fill in some of my stuff about my background. And I had in the top page, I had it kind of separate in terms of what I was going to talk about and then how you can help. But you're all great, experienced hypnotists. I mean, I'm kind of intimidated by being in your presence. And you will know the things that you can help with. So you can just kind of tick them off as we go through that. So yes, I'm Gilligan. I went to CTCA. I had a friend of mine who I worked with down at Rush Presbyterian St. Luke's as a dietitian long time ago. And she said, well, come and we need a 3-month maternity leave. Come and just fill in. And that was 24 years ago. I've not found my way off the island yet. And so when I went there, yes, a dietitian, and I did the traditional role. And when you have those kind of really clear moments that kind of define your life, well, I had one early on. When I was there, and I remember rooms as opposed to, people's faces as much of the time, but I was in a room, and this was before we had genetics. So things have changed. We have genetic testing now, which is helpful. Young woman, probably 40, healthy weight, all those things we think are wonderful. She had no family history of breast cancer. And I'm sitting there doing my shtick in terms of, okay, this is nutrition, and this is what we do, and this is how we do it. And she looked, I would say.
Oh,
you muted yourself.
Kayla, we got you muted here somehow.
Okay. So what I was saying was I was with a patient who I was doing my nutrition intake, and she was one of those people that did not have that, you didn't see any risk factors. And she asked me, why did I get this? And I didn't know. And it sent me on, that question has cost me so much time and money, but it has sent me on a very interesting path of trying to learn about healing. So that's when I went. So yes, dietitian. I went back. I'm also a certified Ayurvedic practitioner. And I did that because I did that when I was in dietitian, because in Ayurveda, they have a much more individual approach to how they deal with nutrition. And it's part of a whole thing that they look at disease as kind of a disconnect from your connection to the greater spirit or whatever you want to call it. So I've done that. Yes, I'm a Reiki master. I do Reiki at the hospital sometimes. I've been trained as a polarity therapist. I do EFT at the hospital. I'm a certified soul collage practitioner, NLP. When I went there, I did my NGH training back in 2003 with Art Leidecker, long time ago. And at the hospital, when I was, there was a psychiatrist there who was willing to let me work with people using hypnosis, but she said, you've got to do the ASH training. And ASH is the American Society of Clinical Hypnosis. That's for people who have, mental health licenses and so forth. So I did that. And I got to tell you, NGH does a better job. They're more practical. But it was good, all training is good. So that's how I got started. And what I will say is, in terms of what I work with people, I have to keep in mind, if someone's coming to you for smoking cessation or whatever you work with, because I don't know what people do, they're making a decision to come to you for your service. When people come to the hospital, they're coming for a cancer treatment plan. They're coming to see the oncologist. And we have treatment teams, meaning that you'll see your oncologist, you'll see a dietitian, a pastoral counselor, a naturopath, and a mind-body person. So we're on teams. I'm on the stem cell unit team where we do stem cell transplants, and I'm on the breast team. So I work with those two populations more than anything else. So I'm kind of an afterthought for patients. And I do kind of, in talking about hypnosis, I do smoking cessation, and I do pre-surgery when I get a chance. It's kind of hard sometimes because they're kind of in and out so quickly. But I would have to say that I do probably the bulk of what I do is waking hypnosis, and kind of, because they're already in a trance. You go to a hospital, you're scared, you kind of go into a whole different state. So I kind of work with people and kind of poke holes in their beliefs when I get a chance. So it's kind of sneaky hypnosis. So that's kind of what I do. Now, in terms of when people come in, they're not just, yes, they're gonna deal with your cancer, whatever type of cancer that you have. But most patients that I see have more than one condition. They have cancer, they have hypertension. And as I go through this, I'm hoping you're thinking about, those are the things that I help people with in my practice. Got diabetes, got heart disease. So there's a time and a place for when people are open and when they can use services. And what I mean by that is, for the stem cell patients, I do a psychosocial, because I see them before they come in for their transplant. And it is a very intense process. And patients can get really mentally unstable because they're so isolated. And one thing with COVID, man, it's made it so hard. It's made it so hard for patients. It's made it really hard for staff as well, because we've just opened up again that some of second floor can have a caregiver with them. Stem cell, they're still not letting them do it, and that's because they're so compromised. And that support from the caregiver is so vital for people. So in terms of, I work with the doctors. I read all the notes. I read all the patient notes. In terms of, like, for the breast patients, in terms of what you can do in terms of helping them. For breast patients, if their weight isn't where it should be, to help them get to a healthy weight, studies show that helps prevent recurrence. So that's one thing. Now, when you cannot do that is if they're doing radiation. I don't care if you weigh 600 pounds. If you're doing radiation, you're not to do anything, not to lose an ounce, because they have to simulate you to do a particular process. So you have to know the right kind. Now, in terms of smoking cessation, every surgeon in the world would love patients not to smoke, because it hinders their healing process. And you'd think that having cancer would be enough to make people go, oh my gosh, well, I'll quit smoking. And no, that's not the case. Because what happened, I get this diagnosis and I'm stressed out, and what I want to do, I want to go out and have a cigarette. So it's really, really important. I'm going to do a few examples as I go through to give you an idea of some of the experiences I've had. So I do the smoking cessation for anyone who wants it. The naturopaths do, they do supplements that help. We used to have acupuncture and we don't right now, so I'm kind of sad about that. But I think I have across my forehead, ask me, because I hear stuff that it's kind of interesting. I had this one patient that she was not my team, but her therapist said, you know, well, so-and-so wants to do smoking cessation, wants to do some hypnosis for that. I said, that's great. So I do an intake in addition to what they have in their charts. So, you know, I'm looking for motivation. You know, why do you want to do this now, kind of a thing. So I'm sitting there with her, and I try to do, if I can, I like to teach EFT for craving control and stress reduction, and do the hypnosis. And so I'm just talking with her about, well, why do you want to quit now? What's going on? And she tells me a really horrific story of sexual abuse that she suffered when she was younger. And, you know, I helped her process that. She had not told her doctor. She had not told her therapist. She told nobody on her team that this had happened, but she told me. So there are times when I work with patients that it doesn't turn out the way I think it's going to turn out. And I'm going to give one more in terms of smoking, just to kind of give you an idea. I had this one lady who, she was, oh my gosh, early 70s, had smoked all of her life. And she and her daughter came for treatment. And she was little and frail, but she was one of those, I call them bird ladies, that, you know, if I wouldn't cross her with a 10-foot pole, because she had a will of iron and steel. And she would incrementally cut back. And she too would tell me things that she was not telling to her counselor that worked with her team, or to her doctor. And I am sad to say that I thought, this lady is not going to do well. She had advanced cancer. She was not doing that great. I worked with her daughter, and she died not of her cancer. She was at a local hospital and had a bowel obstruction. But she got to the point right before that where she says, you know, to her daughter, you know, I think I want to quit now. And that was the first time that she had ever said that. So sometimes I don't get what I'm hoping for, the results in the moment, but they certainly can show up sooner or later. So now we're going to go through, and again, I apologize for this really crazy handout, but I wanted to give you resources. So that's why you see what you see. So the page 1 that says categories, you know, chronic illness. And I like charts. And what I like about this chart is that it kind of gives you, if you don't, I don't know what your experience is in working with illness, but if you get an idea in terms of what's the difference, because an illness can be acute, it can be gradual, it can progress, it can relapse, can do all kinds of things. And this gives you kind of an overview of, you know, what's acute, what's gradual, what's going to be fatal, what's not fatal. So sometimes it gives you an idea of, in terms of time that you have to work with people. So it's just kind of a, you know, you are here kind of broad overview. So that's why I wanted to give you this. And I'll give you one more quick little cancer person. We used to work on weekends, and I did a weekend for one of the other therapists. And weekends you check with new inpatients. And this is I still remember walking into her room. This was Christmas Eve, 2015. And she was sitting up in bed, and she was eating. And I told her who I was and what I was doing. And she had indicated in one of the notes that she was interested in stop smoking. So I thought, okay, well, this will work out. I'll talk with her. She swore like a truck driver. She had this bombastic, you know, bigger than life personality. And so she came, and we used to have little rooms where we met, and I had to be careful because she was so loud that The people in the next room, you could hear through the walls because she was that loud. Now, this is a person that I'm going to talk about later in terms of what I call ACEs, adverse childhood events. This woman has had a horrific life, horrific abuse when she was younger. No question why she smoked. And her daughter was raised by her parents, and it was a very mixed up, really sad situation. And the daughter came to the hospital a few times, and I actually did some work with her and her mom at the same time. The daughter had gone through a lot of drug issues. She was in the process, she's in her 30s. She was in the process of, they were trying to get her in for rehab and to help her. And before they could, she had an event where she talked to her mother, and then she went out and jumped in front of a train and killed herself. And when you think of a person, here's this woman who is dealing, she had lung cancer, this patient has lung cancer, and you think, horrific event. She's still with us. This woman has probably changed more than any other patient I've ever seen. And she has her team. She has another therapist. She has me, and she has a Reiki therapist. And we all see her all the time. And the changes she has made to me have been phenomenal. So it's really possible people can change. So the next page, and I'm going to go through this rather quickly, and you've got my contact information. If you ever want to talk to me, please give me a call, send me an email. Happy to talk to you any way I can. So because when I look at people and I'm thinking in terms of, well, if someone comes to me in a private practice, I'm doing smoking cessation, here I am, I'm just doing that. When I see people at the hospital and I see patients, I'm looking at you. I'm looking at your family system. I'm looking at what you've inherited from your family of origin. So this little piece of paper on page 2 gives a quick overview of what are the stages in the family's life cycle, because people think that we're this, I have child and teenager, and then once I get to be adult, that's it till the day I die. And it's not. Families have stages. And I think right now is a good example of how family stressors are really, families are being stretched to the limit now, because you have, I look at this especially for caregivers. What kind of ability does the family have to care for this person? And with COVID, oh my gosh, I feel so bad for all the young moms with kids at home, and they're trying to work and take care of their kids at the same, it's a tremendous amount of stress. And until COVID gets taken care of, that's what they're going to be working with. And I look at when patients come in, I see who they bring as their caregiver. And I really pay attention, how much is this caregiver paying attention to this person? And it could give me clues about their relationship. It could give me an idea, because sometimes you think there's that time in the life cycle where the child takes over and parents the parent because they're physically not able. And that can happen sooner with someone who's gotten cancer, because they physically aren't able to do a whole lot, especially when they're in the midst of treatment. So that child or young adult might be forced into that role sooner than they would be normally. And there can be a lot of feelings about that. When it comes to, we know treatment certainly impacts a patient's health. Caregiver's health suffers tremendously because of all the additional strain that they're under. So I pay a lot of attention to caregivers and how they're doing with coping with the patient and trying to, help them through this whole maze of caregiving and treatment. So just giving you an overview of what happens in terms of the dynamics in terms of a family and how it can change when a person is going through treatment. So now I'm going to go into the next page because we got a lot to cover here tonight. So I don't know, this was not meant to be a college class, but I wanted to give everyone, if you've not seen it before, it's really interesting. And you know what? I don't I don't do this for patients on a regular basis, but I understand what genograms are, and I invite you to kind of look at it and play around with it, because genograms can be extremely helpful to help you understand yourself, your family dynamics, and to understand, especially when it comes to health issues. The one book that I had on the list, it runs in my family. I cannot tell you how many times I have heard that. I was just on the phone with a patient. I've not met her in person. It was just a phone call. And I couldn't get a word in edgewise because she had to tell me from the get-go, well, I have whatever cancer she had. Well, I have arthritis and I have this and this and this and this. And my mother has it and my daughter has it. And it's like, okay, I am not going to argue with you on this. And sometimes it can be that, yes, there can be things that come down in a family in terms of genetics. And like I said, we do have genetic counseling at the hospital for patients. And it's really interesting because they're targeting therapies based on their genetics information. So I'm learning a lot because we do that with Rest Board, where the genetic counselor will be they're part of the team as well. So it's the type of thing that I think people now are a little bit more aware of, because of Ancestry.com. Everyone's looking up their ancestry stuff. So you can get that. I think it's a lot easier now. My dad did one for our family, but he did it way back before the computer, and he did it on an old typewriter and got all kinds of information. So a genogram is something, and this is pages 3 through 12, and I gave you a whole lot, and you can go through it later and look at it in more detail if you think you're interested. But in terms of how this can be helpful to you, not only personally, but also if you're working with people. There was, his name was, I forget his first name, his name was Bowen. He was a psychiatrist. And this is back in the 60s. And he worked in a mental institution where people are institutionalized. And he noticed, talking schizophrenics, we're talking, really seriously ill, mentally ill people. And he noticed how differently the patients acted when their families came to visit on the weekend. So he was one of the early people who started doing family systems work. And it's the type of thing, it's like, okay, well, I'm the identified patient. I'm the troublemaker. I'm the one, and everyone else is okay. And identified patients are carrying, whether it's a behavior like I'm an alcoholic or whatever the case might be, I'm carrying something for the whole family system. So that's why this can be beneficial. You can use genograms, and I know the McGoldrick and Gerson book, which I have listed in your resources, is probably the gold standard. It's been around for a long time. You can look online and get computer generated genograms. So just make it even easier. But sometimes, especially when you start kind of digging around in a family, looking for things, because you're looking for information that can help that person, the person that's dealing with the cancer, that you can help the caregiver with. And sometimes there are things going on in the family that can be very helpful. They may not be pleasant, but they can be helpful. So, like I say, people know about Ancestry.com, so it's a little bit more, I think, of approachable now than it used to be. And when you do this, even if you start asking questions of a family member, what's the whole process? We want to make the unconscious conscious in terms of helping people with their beliefs and with their behavior. And with family systems, there's a process called the transgenerational emotional process. And it's a fancy word for meaning that whatever one generation does not finish, it's passed on to the next generation, even without talking about it. So, and part of this can be in terms of beliefs about illness. People have some really, sometimes they're conscious, sometimes not, but their beliefs about, who they are, what they can do. It can be the type of thing, well, all the men on our family die of a heart attack by the time they're 50. You can have anniversary death. I'm thinking of Elvis and his mother. So you can have that. Well, my dad died when he was 52, and I'm the oldest son, and so I feel like I've got to follow in his footsteps, because sometimes people can feel that they're being disloyal to the family if they don't follow in that kind of family process. So the genogram can do a whole lot of stuff. It can do a whole lot. You can get unbelievable amounts of information. And if you do it for yourself, you'll be amazed at not only the data that you get, but it'll start to unearth some feelings and maybe memories that you may not even remember that are there somewhere. So in terms of it can be used to help identify patterns of illness in a family. And when I look at a patient chart, I will see, okay, mother has, especially I'm thinking like breast cancer. Breast cancer, you can see a lot where it's mother, it goes to the daughter. I think of Angelina Jolie, who had a prophylactic double mastectomy because her mother had breast cancer. So, people are making health decisions based on some of this information. So, and another example can be, let's say that my husband just had a mild heart attack, but my response is so out of the ordinary. Wait a minute, he's okay. Why are you acting this way? And it can be that what you don't know is that, well, my father died at the same age of a massive heart attack. So again, there's that family idea of fear that this can happen to my husband. So, and I'm just going to talk through this whole genogram stuff, so you don't have to take notes or anything. But I think it's important. I give you a little bit of information about how to code things and what to put, and it's such an interesting process to see it as a visual representation of what people are going through. And there's some, if you look at some families, and you can look online and see they've done famous families like the Kennedy family and other famous families, and it looks like spaghetti because there's so many kind of conflicted relationships and divorces and deaths and so forth. And it's interesting to get it. I can have it in my head, but when I see it out in front of me, it's a whole different experience, and I think it could be really, really helpful. So and now, especially with marriages and divorces and blended families, and it's some people, it's like, I don't know that I have enough time or energy to get married that many times, but some people do. So you start to see what's the types of patterns that people set up with that, and you might say, well, you know what, Kayla, I have an Aunt Mary, and my Aunt Mary has not talked to anyone in the last 20 years in our family. And you can think, well, Aunt Mary is fine. She's broken free of the family drama, and it's called a cutoff. And when someone is cut off from the family, they are more tightly bound to the family than the people who are still there and they're still fighting with each other, still talking to each other. So when people are cut off, and where this can be important is, again, I'm going to be looking at these family relationships. Who's going to be the caregiver for this patient? Now with, COVID's made a difference. People, with the jobs that have been lost. I've had patients who they've been in the hospital and they're getting treatment, and they just got notified that their place of employment just fired them, so they just lost their health insurance. So it's a really challenging thing to kind of think about. And when you look at how people are functioning, and looking at things like divorces, looking at things like alcoholism and drug use, and childhood illness, another really interesting piece of this puzzle. So if you look at all these things, and on the bottom of page 6, it shows kind of how you do, describing what a relationship is like, whether that's close or not close. So that can be, I think, a real important thing. Now, page 7 is talking about all the different things that you could do with a genogram. I mean, it's almost endless. And the part that I look at probably the most would be the last one, category 6, in terms of family balances and imbalance, because how is this family functioning? Sometimes you can see as they are going to their appointments throughout the day, you can see the caregiver is just ticked off. They're feeling put out. They're frustrated, and just not really very supportive of the patient. And other caregivers are, my gosh, they're the most wonderful people in the world, and are able to give and give. And sometimes I go, whoa. I'll give you an example of from my stem cell group. I had a man who was in his late 40s, and he needed a transplant. And the type of transplant he needed to be in the hospital probably, I think, about three weeks or so. And then for someone who does a transplant, they have to commit to being at the hospital for 100 days, because there's a lot of follow-up after they have the transplant. They do a lot of work afterwards. And he had a significant other who was, she was a little bit younger than he was. And it said in the information that she, before this even started, that she was a little hesitant because her father she cared for him, and he had died of brain cancer. So she was kind of scared of watching her. And again, she couldn't be in with him because we weren't allowing caregivers in. So he did the transplant, and this guy, for a lot of different reasons, totally fell apart. And he got to the point that he was acting out, doing very disturbing kinds of things, to the point that when he was discharged to outpatient, he was supposed to stick around, and he was so disruptive to the hospital, they agreed to transfer his care. Now, if someone's had a transplant, their immune system is almost kind of non-existent. It's like a little baby. And getting on a plane is the last thing I would ever want to do if I just haven't had a transplant. But he was so determined to get out of the hospital because he had a lot of, I would call them ACEs, which is adverse childhood events. He was so traumatized by being back in the hospital, he would rather face that than stay there. So knowing how people function, how they, and sometimes, you just can't know until you get there when you do that. So that's page 7. So that's kind of the biggest part that I used from that page. Now, page 8. This is the one that I would invite you to kind of look at, and you guys know what kinds of issues on this page that you already deal with. So in terms of, you might be working with patients with relationships, and if you do, and if you don't know it, there's one book called The 5 Love Languages that I think is really helpful, because sometimes people don't know how to communicate, even though they care about each other, they're just not speaking the same language. I think a couple things, in terms of drug and alcohol, always an issue. Identity is a huge thing, because what happens, you have this, I'm a therapist, I'm a wife, I'm a mother, and now I've got this new label. I've got this cancer label, or I've got this diabetes label, or heart disease label, and it changes people at the level of identity. And there are things that you can do to be helpful with that. I think another thing, in terms of dependency, because let's say that I've been a very active person, I've been working, and now with this, I'm too sick to work, so I become dependent on my spouse, and that changes the relationship dynamic. It changes the financial dynamic, and sometimes when it comes to finances, I have seen more than once where um, a person, it's usually the female, staying in a bad relationship because the husband carries the insurance, and without the insurance, they don't get treatment. So here's my choice: stay in a bad relationship and be treated and be miserable, or face trying to get treatment on my own without that support. So it could be a really hard thing to do. Now there's another issue that I don't think people talk about as much, and maybe David or Don or one of you people who were at the Mid-America, the last, I think she was at the last conference. She had an English accent. She presented, and she did sex therapy with hypnosis. Does anyone remember who that is? Anyone?
Might be Kaz Riley from Australia.
Okay. So she's doing sex therapy, and sexual issues with dealing with cancer is a huge area. We have two people that work with that. One works with the fertility issues in terms of helping people preserve eggs if they need to. And the other is she works in our department. She's a holistically trained RN. And she works with what I would call kind of the plumbing problems in terms of when people have had sex-related cancers, and helps them with that. And the rest of us help everyone deal with relationship piece, because you've changed, your body's changed. There might be some body image issues, especially I'm thinking, women who get breast cancer and have to have surgery. I mean, that's a massive change. So it's important to realize that that's an area where I didn't get to see that lady's presentation. I wish I would have, but that's an area that you can be a huge help for people if you want to. It's up to you if you're comfortable with that. So the next page talks about the health genogram, and when I'm kind of talking with patients and getting, it's probably more an informal history, unless I'm doing a psychosocial assessment. I'm always looking for resources in that person, in the family. Every family deals with crisis and with loss. I'm thinking of like Texas and what they've just gone through. We are coming on to tornado season here in the Midwest, and that's always interesting. So how do people deal with crisis? How do they deal with loss? Certainly with illness, but just in general. So sometimes it's, what is it? Is it something that is like a one-time crisis, like a tornado, or is it ongoing, that my family's been homeless for 10 years? So you can find different resources with people, and I think it's the types of things that helps a family get through those types of crises can help in terms of dealing with cancer and with treatment. And I am just I am humbled by everyone that I work with patients, people that are dealing with things that are just sometimes beyond belief. And it can be hard sometimes to be with that, because it's people are, one person has cancer, they have a child, with cerebral palsy. They're dealing with a relative that they've been taking care of for years. It's and losing jobs and all those things that happen to all of us. And I'm amazed at how resilient people can be, at how determined they can be to get through this. And it's an amazing thing. And I want to get through the rest of it, so I'm going to go really kind of quickly here. The next page is just kind of how to fill out a genogram. So you can look at that. You don't have to do it now. Page 11, I gave you a couple examples of what it can kind of look like and how you can kind of start to see patterns. So page 11 is showing in terms of illness in a family. And if you look over at the right side, in terms of those are all kind of head related things. You've got strokes and brain tumor and car accident. And it's interesting when people have repetitive accidents. It's certainly something I would look into if I were working with someone. The other side, heart disease, and when I look at both of them, Italian and Irish, I would make a guess that they were both kind of Catholic in terms of their religious background. And the Irish actually at one point had the highest rates of schizophrenia of any group in the world. And part of that is because they'd been taken over by the English for a long, long time. Now, the next page is about alcoholism. And this is something, whether it's alcohol or drug addiction. And when you think of drug addiction, it's not just regular drugs, it's the opioid crisis. I don't know if anyone deals with that. Huge, huge problem. What I can say from my experience with the hospital, maybe 5 years ago, you might get a whole bottle of an opioid drug, OxyContin or whatever. And now when they sit with you in terms of, okay, here's the type of surgery you're going to have, this is what's going to happen, you are asked by the pain management team, how do you plan to deal with the pain? They will give you some pain medication, but it is much less because doctors are watched like hawks now when it comes to pain medication. So that's another, this is a huge issue in terms of helping people deal with pain. Some of it is cancer related and some is not cancer related. So doing hypnosis, a wonderful thing to help people with. And with this page, the top just shows who's an alcoholic. I like the bottom one actually a little bit better because it talks about the functioning, that usually an alcoholic is under functioning and the family members pick up the slack. So this is the type of stuff, if you start to play with it, I think you'll find it really interesting. Whew, okay. Now, one thing I didn't put in, and I apologize, but I'm going to tell you, you probably know about it already. Elizabeth Kubler-Ross is a Swiss psychiatrist, and she wrote a book in 1969 called On Death and Dying. And she came up with the stages of grief. And if I didn't know if people were interested in working more with cancer patients or not, but what I will say is if you are interested, you need to be really comfortable with grief and loss. I'm sure some of you do EFT, helping people with tapping, and I do it too. And like I said, I use it with people with smoking cessation, but I use it just in terms of stress reduction because sometimes I don't have a lot of time. And I'll get people that I'll say, okay, do you want to learn this technique? Let's choose a quick issue and we'll run through and do it. And then I've got a handout and blah, blah, blah. And they'll look me dead in the eye and say, I'm afraid I'm going to die. So that's where I start. That's where I start. And if you start there, you have to be able to be with that person and walk with them because that's when they feel most alone. And so being able to be, I'm in rooms with patients, not because of COVID, but if they're on a vent and the decision's been made that they're going to take them off the vent. I'm in the room when people die. I did, this was years ago when I was when a dietitian, I thought, I've got to figure out how to deal with this because it was overwhelming. Dannon Brinkley is, he was kind of a good old boy from the South and he got hit by lightning twice. So I don't think he learned the lesson, but he wrote, I know one, I think he wrote 2 books called Saved by the Light. And he was not a great guy before this happened. Afterwards, he kind of changed his life. And he did a program on hospice volunteers, and I took his training as a hospice volunteer. It is, I recommend it to anyone because it helps you get more in touch with how you feel about your own death and about if you have a family member who's facing death. So it's something that I think is, and there's other programs that will do that. So she came up with stages of, she interviewed dying people and came up with this process that they would go through. So the stages are, first one is denial. And this is when it's like, I get this new diagnosis and it's still, cancer is still a shock. So I go into what happens? I go into this light trance and doctors have to tell you, okay, Kayla, you have this kind of cancer. And it's at this stage, and here's the results in terms of our research. You will, live 2 years. And I've seen people who take that in as a post-hypnotic suggestion. And they'll tell me that in my intake. Well, the doctor gave me 2 years. I said, I love to prove him wrong. I use humor a lot at work. It sounds kind of crazy, but you've got to kind of get them out of the trance that they're in. So denial is the first stage. Anger is the second. And that's one thing that I think where I work, people like to be really positive. And I'm fine with being positive if that's how you truly feel. But being an energy worker, I talk to people in terms of being congruent. If you feel positive, that's great. If you're angry, I have one room in my therapy room, and that is you can say anything, you can yell, scream, cry. I don't care. There's just no hitting. That's my only rule. There's no hitting anybody in my room. But giving people permission, it's okay to be angry. I've had a young man. He's 25, and he is getting a stem cell transplant, and he is so angry that he is totally shut down. And sometimes we get a lot of people of faith, and faith is wonderful, but sometimes they're afraid to be angry at God. I said, I think God's bigger than all of us. I think he can take it. But sometimes, especially for people who repress their feelings, that's another thing that is really a big problem with some people dealing with cancer. You repress your feelings, data shows you will not do as well. So I would rather you get angry, you express it, and let it go, because it takes more energy to repress that feeling than to just express it in a way that's constructive. So that's the second. Third is bargaining. Okay, all right, God, if you let me do this, I'll go to church every Sunday. Or if, we kind of like try to negotiate with things. And I can feel helpless. There's, so all these feelings that people have. So that's stage 3. 4 is depression. And when I see people, if it's a new diagnosis, a lot of times they're still in that shock stage. And it might be maybe the second or third time they come back where they go, oh, okay, now I get it. It takes time for that information to kind of sink into your consciousness and for you to be able to accept it. And that's the 6th one, or the 5th one, I'm sorry, is acceptance. And acceptance doesn't mean that you like it. Acceptance means that, all right, now I can make a decision about what I want to do. And that can be treatment, that can be not treatment, it can be all kinds of things. So again, this goes for everything. This goes for the diagnosis. This goes for how I'm going through the whole treatment process, the ups and downs. And you don't go through it one time, you kind of cycle back and go through it a lot of different times. And now we're on the last part, which I think is really kind of important. So we're on page 13 now. And this is about this little picture about traumatic event. We all have traumas. And the things that are listed, these are some of the reasons why people might come to see you. I might come to you because I have insomnia. And in terms of issues that people with cancer deal with, chronic pain, anxiety, depression, fear of recurrence. There are over 14 million survivors who have gone through treatment and they're doing okay. But you know what? They've got to go back and get tested every so often. And every time, or I have, I've got this little ache here. Or is there a lump here? So every little ache and pain, there's fear of recurrence. So if you can help with people with that, you are doing a tremendous service to people. Please, please, they need help. Fatigue is another huge, huge issue. And just in terms of helping them with their energy levels, their ability and motivation to do things that they know are kind of healthy for them to do. So those are the types of things that might happen. Now, the last thing we're going to cover, and we're going to get there, it's called the adverse childhood events. It's called the ACE study. And I included this because I think this is really important. let me get his name. Dr. Vincent Coletti worked at the Kaiser Permanente Department of Preventive Medicine, and Robert Andra, Center for Disease Control and Prevention Research. These two researchers analyzed the records of over 17,000, I'd say normal patients. They weren't just cancer patients, but they were screening for commonly reported events, childhood events. And what they found was that there are certain events that happen in childhood that can predict future illness. So if you haven't heard of the ACE study, there's lots of information on it. But in terms of what they found, things that are predictors, there's several things. One is abuse. It's sexual, physical, or emotional abuse, neglect, emotional and physical neglect, different types of dysfunction. And this is why we do the genogram, because you will pick this stuff up. So dysfunction includes parents divorced. I mean, look at our divorce rate in this country. My gosh, it certainly happens. If a child witnesses a mother or stepmother being treated violently, and with COVID and people stuck at home, the rates of reporting of domestic violence went up tremendously last spring. So this is something that's going on all the time now. If a family member is addicted to drugs, and keep in mind the opioid crisis, not just the other types of drugs. If there's a family member who is suicidal or mentally ill, and I don't know if anyone saw the Meghan Markle and Harry interview with Oprah. I thought it was striking that she admitted to feelings of suicide. And when you go back, there was an interview with Diana, and it was spooky because she was kind of echoing the same type of not being accepted by the family, not getting help from the family. And, you know, this is 2 generations of this. So I would want to make sure that their kids were okay. And family member being in jail. So you think, well, okay, so what? I mean, it happens to a lot of things. What they found was that the higher this score for these adverse childhood events, the more likely you were going to be to develop not only medical, but mental and risky behavior issues. So diabetes, heart disease, cancer, chronic pain, autoimmune diseases, fibromyalgia, chronic fatigue, most sleep disorders. If I don't feel safe going to sleep at night, because I'm a child and mom and dad are yelling in the other room, sleep disorders, huge thing, especially with people dealing with cancer. So you think, yeah, okay, people have this. But they found that if you took the ACE test and you scored 6 or higher on it, this could shorten your lifespan by nearly 20 years. This is not a minor thing. And of those health issues, how much money do you think we are paying out in health-related costs for all of those things that are related in part to children and how they're treated? Mental health issues, anxiety, PTSD, ADHD. And what this does in terms of behavior, it's like, well, I don't feel cared for as a child, so what am I going to do? I'll probably start drinking and drugging and maybe early sex, might be violent. And in terms of functional issues, memory issues, do you know anyone with memory issues? You might look back and see if they've got some of this stuff. Less education, less money, so it's just amazing. The next page just is a nice overview in terms of, you know, what this looks like. So people come to you for that symptoms. Well, I've got insomnia. Well, you want to go back and find out what's the root cause of that insomnia and help them with that. Now, pages 15 and 16 are a version of the ACE test. And you may not give that to the people that you work with. You certainly can ask some of the questions. You know, did you feel that you were important in your family? How is your family in terms, did they kind of look out for each other, or were you all kind of on your own? And people will tell you. So if you do a genogram, you will get the answers to some of these questions as well. So that's why, again, I go back to that. Now, page 17, this was just one quick, I could do pages and pages and pages of this, but these are some of the beliefs that can come from these adverse childhood events. And when I look up at the top, the lack of self-care, the top one, I neglect or ignore my own needs. This is the female breast cancer patient who is, I'm the caretaker for everyone. I give care to everyone else and I don't take care of myself. Huge, huge issue. Or again, this is more for women than men, remaining in bad relationships because I think that's all I deserve. And the ones underneath, you know, this is where you're getting down to those beliefs, these family beliefs. This is what I believe about myself. And because of my belief, this is how I act. This is how I take care of myself or how I ignore myself. And hypnosis, oh my gosh, you guys know this, could be so, so helpful to deal with that. So that's like all of the, you know, kind of an overview of looking at people, seeing what you can do to help them out. The last few pages, these are just a few, and oh my gosh, I could fill books with this, of what can you do to help people. And you know what? People, I think we're a very lonely culture. And when it comes to health, if my family is tired of listening to me talk about my health issue, having someone, a witness to really witness what I'm going through, that alone can be incredibly healing, incredibly healing. So this page 18, is just getting, you know, what's going on in your life in terms of what are your symptoms, your thoughts, emotions, body sensations. And for some people, they've got no clue what their body does. And this can be real helpful to kind of bring things to a more conscious state. The symptom part is especially helpful if I'm going to my doctor and, you know, it's like, okay, doc, you know what? I had insomnia. When? Yeah, I don't know. Well, I couldn't go to sleep till 10 o'clock Monday night, midnight Tuesday night. So if you bring in a symptom diary for pain, for all kinds of things, it would be really helpful for the people that are trying to work with you. So that can be, it's quick, easy, and helpful. The next page, I just threw this in because journaling is another thing that is easy, low tech. You can do it on the computer if you want to. But what I thought was interesting about this is that people say, well, I want my immune system to work well. Well, look at this. In this study, if I talked about my trauma, if I did a journal about my trauma, guess what? My T cells were more active than people who didn't. You know, we talk about, well, we're going to take this wonder drug, but you can help your immune system just by journaling. Really, really simple thing to do. And I really like the last page, 10 characteristics of spontaneous remission. Because you know what? There are spontaneous remissions of cancer. And nobody knows why, but they studied this and found that these were the characteristics. So these are the types of things that you can work with people that you work with. And there's certainly a number of them that can help in terms of using hypnosis to help them with that. You know, having that, I like number one, that even though I may not get a good prognosis from the doctor, I can have a deep belief that I can heal myself. And that can make a huge difference. I've seen patients who, if I looked at their chart, think, oh my gosh, they're going to be gone in a couple months. And because they had, especially, I'm always looking for, what are you looking forward to? What have you not done? And it's like, well, my daughter's getting married next summer. And guess what? They live till next summer. They do it. You know, people have an amazing ability to impact their health. And that's what I see that all of us can do, because I know that all of you want to help people and people dealing not only with cancer, but illness in general, because what I from 10 years ago to now, doctors don't have time. They don't have time to listen to people. You're not there to diagnose. You're not there to cure them. You're there to support them and be with them. And you have no idea how incredibly healing that can be for them, because there are people that nobody's listened to in their whole life. So now I gave you a resource list at the end. And there's a number of things that I think are beneficial. The last one, the Adverse Childhood Experiences Recovery Workbook is brand new. It's got a lot of really good stuff in it if you don't know about it. And it can give you some ideas to kind of educate yourself about it if you're interested, and help people. Okay, I'm done. Questions, anything?
Well, thank you so much, Kayla. This has been very enlightening, and I actually have a couple questions. One
Okay.
on you talked about cutoffs. When people cut off from the family,
Mhm.
it makes a difference whether they're cut off or they cut themselves off, doesn't it? I mean, if a person gets out because
It's more
this is a
that I
toxic
choose. Yeah.
situation and I got to get out of here, that's different than shunning, right?
Well,
That's-
it's more that, okay, Donald, I'm mad at you, and I'm not going
I'm
to talk to you
sorry.
ever again.
Oh.
Yeah, you know, what can I say? Um, so I make the choice to not speak to you again. I'm not talking about there's a dangerous physical situation that you have a gun and I'm trying to avoid that. I'm talking about I make the decision, and I think that I'm free of the family because I don't talk to them anymore. But you are not free of the family. You are still enmeshed with them every bit as much as when you were fighting with them. So no, it's a good question. And no, you are not, I'm not talking about a dangerous situation. I'm talking about, you know, I'm so frustrated with you and with everybody, you know, to blazes with all of you. I'm walking away and not talking to you ever again.
Yeah. Okay. Anita Morjani. You know Anita Morjani? You've heard of her?
She wrote a book.
She wrote a book, Dying to Be Me.
Oh, yes.
And
isn't that wonderful?
it's amazing story. Yeah. Yeah. There's a
Yeah,
person who had a spontaneous remission, and
she
I mean
did.
she was
Yes.
like done and out the door, and she came back and is healed. So it was, but she gave herself to everybody else and said, "Oh, everything's fine, and I'll do everything for everybody else," and not taking care of herself. So it's a good
I
lesson.
tell, yes, that's a, that should be on my list. I highly recommend it. I tell it, it's more so women, because they tend to be more kind of caregivers for people. I will tell them, it's like, I had a woman, this was a long, long time ago. I had just started and I didn't know what I was doing. I was still kind of scared of everything. And I went to see her to do a nutrition intake. You know, I'm just like, I'm going to talk to you about fruits and vegetables. Okay. And and you know, it's interesting. You want to talk food fights? Oh my gosh, you could do a whole thing on food fights in camp. So I'm talking to her, and you do, it's called a 24-hour recall. So what you have for breakfast, what you have for lunch. And she came by herself. She was a breast cancer patient, and she could hardly answer me. And there was just like, there was no life in her. There's no energy. And I hadn't done this before, and I'm very careful about it. I'm really pretty direct, pretty honest with people, because I think they like that. But I'm sitting there and I'm saying, I'm getting really frustrated. And I just stopped. I said, you know, I'm going to say something, and I apologize in advance if you take it the wrong way. But I said, you know what? Fruits and vegetables are really important, and I hope that you can do this. But I said, because, you know, her husband wouldn't help her. You know, it was just all this. No one can help. No one can do anything. I said, you need to go home and you need to find someone who's going to support you. That can be a girlfriend. It can be a hospital or a faith group. It can be a hobby group. I don't care. You need support more than you need, you know, green peppers. and that was it. You know, I saw her and I thought, okay. A couple months later, I was doing inpatient rounds, and I walked into this room. And I mean, I see a lot of people there, and a lot of times I only see them one time. And I'm talking to her, and she sat there and she said, "You may not remember me, but I'm the person that you told to go home and find someone." And she did. And it blew me away. So sometimes being really direct and I mean, that was from my heart. I love my patients. I love them. They are wonderful people. Even when they're not so wonderful, they're still wonderful people. And they inspire me. So any other questions?
But I think we're all inspired by you too. So thank you. Yeah.
Okay.
Any other questions?
And if you don't have a question now and you want to, I've got my contact information. You can email me or give me a call. Yeah, Paul,
Yeah, thank you.
you unmute.
I know. That's going to be my epitaph, you know. He never learned how to unmute himself, and now he's talking. It's like, I just wish he would just shut up. But anyway, I'm very, it's a brilliant presentation, and I really admire your compassion. And the thing that I'm wondering about too is just, I mean, you're so close to these people, who are suffering and near death. I mean, how do you take care of yourself, and how do you take care of yourself, and how do you come to terms with mortality yourself?
It's a really good question. It's taken a long time. I remember, again, there's certain patients that just touch your heart in a way. And she was a stem cell person, and she'd had a transplant, and she did well, and she was just an incredible woman. And I knew her husband, and she was doing okay. And I don't even know why I said it, but I said and I was a dietitian at the time, and I said, if she dies, I'm going to quit. And I was, on vacation or something. I came back, and my boss didn't want to tell me, and she had died. And it really I'd had a lot of people die, but it just kind of a crisis, of conscience. And what I've learned is that how I take care of myself. I have a supportive family. I have a dog. He's not a therapy dog, but he's my therapy dog. I'm trying to learn how to do tarot readings just for myself, not for anyone else. And all the classes that I take, I'm what Art Leidecker called a pencil pusher. I will hopefully be taking classes till the day I die. And my father had cancer. I took my mother home hospice, and that was probably one of the hardest and one of the most beautiful experiences of my entire life, because you are birthing a person into their next life. Yeah. And you have sad things, and I call them jewel moments, where it's like, it'll just take my breath away. And I am honored to be in their presence. And believe me, there are some that are just stinkers, and I just want to boot them down the hall too. So, but I try to just be really honest. And I think it's because I've had the experiences with my brother had cancer, my father had cancer, my husband's dealing with cancer. So I know about this. And most people are, whether it's family or friends, it's something that's going to touch most everybody sooner or later. And just being with yourself. And I give myself permission to cry. I get mad at God and say, these are nice people. What is wrong with you? I was really mad when they took acupuncture away. I had a patient, they wanted to learn tapping. And I go, okay, all right. And it wasn't my team. And they were late, and I was tired, and I thought, oh, I don't want to do this. And they showed up, and I could tell the husband was the patient, and I can tell by looking at them if they're going to make it or not. I just know. And did the tapping, and afterwards they were going to go home, and the wife went to the bathroom because they live locally, and he sat there and he said, I just got bad news. I just got told that there's might be a clinical trial or it's hospice, and he hadn't told his wife yet. And I go, shut up, Kayla. People are dealing with so much. And whatever I can do to help them, it's like you want to make God laugh, tell him your plans. I was never going to work in a hospital, ever. Man, did I get lost. So I don't know if that answers your question, but it's day by day. I work with a good group of therapists. We help each other because we all have losses, and so we help each other with them.
Mhm.
And I have a faith, so that helps too.
Okay.
I have a question. Are you, sounds like you're still working full time with the team that you've been with for a while. Are you also taking private clients?
Not so far. I plan to. That's on my list of things to do. So I'm working on it.
Thank you.
Yeah, thank you. Yes, Deborah.
So I am a big sister through Brothers and Sisters of America here in Prescott, and I took a program with them, and it was an ACE class.
Oh, good,
And
good.
I was just blown away by how many of these kids are being abused or have been abused in the past. And I'm taking this class and I'm reading through the booklet, and I'm just crying because my little had suffered some abuse, and she and I are having some real heavy dialogues, and very open and honest. But I'm seeing some of the characteristics of going through the list that you had here that she possesses. And I've done some hypnosis with her with permission from her aunt, who is she adopted her. It was her sister's daughter. And what these kids are going through today is horrendous. And the amount of abuse that's going on is mind-blowing. And I'm glad it was a match made in heaven for us, because she is very open, and we have these dialogues that are wonderful. And I just want to make sure that I'm doing what's right by her and guiding her, because I'm not a clinical person that knows how to do this stuff. I'm only doing the best that I can for her. But what really amazed me is, Big Brothers and Big Sisters did this class because it's so prevalent, in our society still, and even maybe more so. And there's so much drug abuse from parents. Her mother is still an abuser. Father died of an overdose. And so you can imagine some of these kids and what they are going through, and what's the possibilities down the line for cancers, because we know something that's eating you up inside is probably going to somehow eat up your body somewhere, somehow. So in dealing with children, do you deal much with children in this situation?
Our hospital, we work with adults, but I work with the inner child of the patient. I have one patient that I work with. She's got stage 3, stage 4 breast cancer, and she's a nurse, so she knows a lot. And she's thinking in terms of, well, I may or may not be around. And she's the only one, because I have to be very mindful of what I can and cannot do. And she brought up past life therapy, and we've done some. And I think for kids, depending on how old they are, certainly to do some inner child work. You don't have to do deep hypnosis for that. But, I think a lot of our problems would be much better off if we really paid attention and put time and money for child development. We don't care about kids. I mean, even kids, who have good parents, in terms of, it's not a high priority unless you live in an area where, people have money. And I don't care what you think in terms of politics, but the separating of the kids at the border, those kids are marked for life. And you know what? They're going to end up somewhere, whether it's here or back home, and they're going to be, and it's not only that they will be scarred, but they will scar their children. I mean, so it's like what I think of this, and especially that's why I like the genogram and working with a family system, because if you make a change in one person, you are changing that family forever. And it doesn't have to be big. It can be that you help someone love themselves and accept themselves more. That's like that butterfly wing, fluttering that goes across to China. It's really, really important. And I think the most important thing, yes, there are people who are, take classes and so forth. But if you have an open, loving heart, I don't think anything beats it. I just don't. People respond. We need that. I think we are a society that is so hungry for love and acceptance. It's sad. I'll shut up.
I have another just quick question regarding cancer center treatment. You mentioned that they have naturopaths there, and how, I have a naturopath. That's the doctor that I go to, but you got to pay for everything. Insurance doesn't cover that. Is there insurance that covers naturopathic treatment?
Naturopathic, the only thing that you pay for is if you buy supplements there, you pay for that. You do not pay for the naturopathic visit.
Wow.
I tell my patients that I'm a cheap date. You don't pay for my time. And I've worked with one of our other male therapists. He's a 40-year marriage and family therapist. We have done couples counseling for patients because, it impacts the whole relationship. And I tell them, I said, do you know what you would pay for this? Because they're not charged for it at all.
Oh.
Yeah.
So who picks up the tab for cancer treatment centers? Is there just, organizations and individuals?
It's just they look at it. If you do nutrition, they charge for that. Not charged for pastoral counseling. The naturopath, the one thing that we charge for, we do Reiki sessions. There is a charge for that. But in terms of our time, the hospital knows and the teams know. Like, I'll give you an example. If someone gets bad news, it's funny that people can be working in a cancer hospital and be so unnerved by someone crying. It's like, well, duh. Of course they're crying. You just told them that they had progression. So they appreciate that we go in and kind of smooth the feathers and help not only the patients, but I do a lot of staff support. I mean, if you go and offer anything to help any hospital staff right now, oh my God, they are stretched to the limit. They are burnt out. And I've got staff that I've known for years that it's like, I'm seriously worried about them because they just can't keep it off. You just can't.
Yeah.
So any type of stress reduction, Zoom meeting you can do, anything would be helpful and greatly appreciated.
Wonderful. Thank you so much, Kayla. Appreciate this wonderful presentation.
Well, thank you for being here, guys. I really, really appreciate it. And again, you've got my contact information. If something comes up, please feel free to send me an email and we can talk on the phone, and that would be great.
Great.
Thank you not only for tonight's presentation, but for all the good work you do.
Oh, thank you.
I just wanted to ask, you'd mentioned when you were talking about food, something about food fights, and so, but no, I'm curious because there's a history in on one side of my family. Apparently my grandfather used to start food fights and then tell my grandmother the kids started it. It was like this big thing. And it sounded like there was more to that on maybe like on a psychological level. And I haven't heard any, previous study stuff about that.
With food fights, there's a therapist, his name is Salvador Minuchin, he's Italian, and he would do therapy at the family dinner table. He worked a lot with people with eating disorders, and I was a volunteer for the program at Highland Park Hospital, and they did a session, they did a family meal in front of a whole group of people. And you'd think that the family would be self-conscious, but they drop it after a few minutes. And it was the daughter was anorexic, So, but as we're watching them and they're, she's kind of playing with her food and stuff, the person who wasn't there, who should have been, was her grandmother, who had been in a concentration camp in Germany during World War II. And what I mean in terms of my patients, people, there's a term, it's called orthorexia. That's where I will only eat the purest of the pure. I get very rigid. And I sometimes people like an anorexic can use that to kind of control their family. There can be patients who have decided, you know what, I'm done. I've done enough treatment. I'm tired. I don't want to do any more. And the family pressures them to be eating in a particular way because they're not willing to give up. So food fights mean that the family dynamics plays out in how and what they eat and how they eat. So I had been trained as a therapist while I was there, and boy, it was really helpful. You get some of it in dietetics, but not nearly enough. Not for
Right.
those type of dynamics.
And I've definitely heard a lot about arguing back and forth about how you get to eat what. I was just curious if the more physical throwing things at each other.
Oh,
had,
no.
Had also had a part in that I hadn't heard about. Because
no, it's more guilt. Oh my God, I got this because I ate McDonald's French fries. I got this because I didn't eat all organic. It was interesting because when I would see patients that I would call people who really did not live a really great lifestyle, they never asked why. They just, here, give me my chemo, give me my drugs, and let me get back to my life. And I really tried to work hard to help people, yes, you ate French fries. Okay, it's over. Get on with your life. Sometimes I just give them a kick in the butt. So a lot of stuff can be played out in food. A lot. I've worked a lot with people with eating disorders, with a group up in the northern suburbs, and very complicated. And I've seen patients that they can start, I can see it in their thinking where they start thinking like a person with an eating disorder. So they can go down that path. Because if I eat this food or I don't eat this food, that's going to cure my cancer. And I wish it were that simple. It's just not.
Oh, I've definitely talked to people talking about the things that they enjoy eating that are terrible for them. And I always like to point out that they've done studies that have proven that happiness does make you healthier. So there is some balance in something like those French fries. If you really love them, they might not be as bad for you as you think. I mean,
Yes.
there's balance. There's lots of balance in there. You can't just only eat stuff that goes in that kind of direction.
Well, and there's so much, that's another whole talk. There's so much guilt around that. And I would tell patients like, oh my God, I shouldn't eat this. Oh my God. And I said, eat it or don't. Stop with this stuff.
Don't should on yourself. It won't help anybody.
No, it doesn't.
Right. Thank you.
Okay. Thank you. Okay. Anyone else? Are we done? It's up to you guys. Yeah, Paul?
Just a quickie, but what about somebody who just will not eat vegetables except for salad, just hates vegetables? Is there some kind of shtick about what's going on?
Oh, I'd have to know a little bit more about that. You can get the benefits in a lot of different ways. You can even, how like for little kids, they've got those vacuum packs of like pureed. Try that. Excuse me. One thing that I like about Ayurveda is that they are very big on the tastes, and most American food is pretty bland. They have, it's called 6 tastes, and getting those taste buds kind of, they think of food as information for your body, not just calories and protein. And sometimes, and that's another thing that's a big issue with people going through cancer treatment, they have taste changes because of the chemotherapies and so forth. So for vegetables, I would take away any guilt and say, well, you can get those nutrients. Do you like fruits? You can get it that way. You can take, and I don't like to just do pills, but you can do juicing. You can do all kinds of things. You just have to get creative about it. But I first and foremost, get the guilt out. It doesn't help anything. Or are they doing it because they just want to be defiant to you?
Yeah, guilt and the stress that goes with that does a lot of damage. And
Yeah,
so
yeah, it does.
it's, and like Om said, about don't should on yourself. Um, Ironically, I just did an article last month for a magazine I write for. And it is, don't should on yourself was the title, and it's all about shoulds and how we get shoulds on ourselves and we get shoulds from other people, and just too much of that flying around. So we need to start loving ourselves and step forward with that
Absolutely.
and
I
love
agree.
ourselves so we can love each other. And so thank you for your love and
You're
compassion
very, very welcome. Thank you for
for
having me.
us and what you share the world and your patients and stuff, your clients. So thank you very much for everybody for being here tonight at the Second Tuesday Hypnosis group. And we'll probably be meeting maybe a month from now, maybe on the second Tuesday again. So thank you all for joining me at the Leaning Tower Y here. And thanks again for Kayla and her wisdom. Remember that her on the handout, all of her information is on that. The handout I did for anybody who didn't check their email this afternoon, it did go out this afternoon. So it's there and it's a valuable resource. I read through that this afternoon. It's amazing the stuff she's packed into that little space. So thank you all for coming, and
Okay.
we'll see you next
you.
month.